Hello and welcome to Revolutionary Mental Health. My name is Debbie Nelson, and I am joining Dr. Julia Britz, who I have such admiration for you, Dr. Britz, and what you've done and what you treat and how you help. And I'm a huge fan of you. And this won't be the first or last time that I feature Dr. Britz on this because she is a powerhouse when it comes to helping people with mental health. So, welcome, Julia.
Wow, thank you so much.
Well, there's certain people that over the time, when you hear back time and time and time and time and time again of referrals that I give you, of people who are so pleased with the treatment that they've gotten, but more importantly, they get better. It's
Mm,
not hard to promote something like what you do. So
thank you.
I always like to kind of start, although I've heard your story, many people have, but it's so special as to why you're so good at what you do and how you got into
Mm.
this.
Oh, wow. Okay. Well, it's it's funny. I feel like I tell it slightly different every time because I remember more things, when I look back and kind of think of where I started. But yeah, I was a very nervous little kid. I was a super shy kid. And that's okay. There's nothing wrong with that. But I do think that's kind of what I see with a lot of people is like you have these little natural personality quirks, but then when there's that inflammatory process, it sort of turns those quirks into something a little darker. And so for me, I started out as this kid who just I really wanted to please my parents, perfectionistic, really young, and scared of a lot of things, just nervous of everything. And then eventually, what started to happen was I noticed that I was different than other kids because they seemed to be able to hide how anxious they were, and I was like, God, I suck at this. Like, why? Like, what? It's so annoying. They seem like they're just like getting through stuff. Um, and so when I was around 19 or 20, I think in, my first, second year of college, that's when I started noticing that it was getting a lot harder to hide some more of the compulsive behavior I was doing. So I was spinning around on staircases and like going into parking spaces and backing out and then repeating that, 10, 20, 30 times the entire drive, I would just be turning the radio on, off with my finger. And it wouldn't be uncommon for me to exit off a freeway thinking, oh, shoot, I think I might have forgotten that I ran over somebody on the freeway. I should go back on and check one more time. So it was, a lot of that kind of stuff. And a lot of classic OCD things. And so for me, I was way too scared to try medications. I didn't want to do that. I knew that they could cause, different things like sexual dysfunction and weight gain. And I was really scared of all that. And so, luckily, I hurt my neck. I hurt my neck. And it was like a weekend, I think. And so no one was open, no chiropractor was, except for this one person in town. And it's like, yeah, I'll come in the office. You can come in. I couldn't turn my head. So when I walked in, he was working on my neck and he's like, so how's your period? And I was, oh my gosh, how dare you, man, ask about that. So, um, but it wasn't great. I told him that. And so he gave me a couple supplements and then I had the best sleep ever that night. And I was like, oh my God, what else you got? And he's like, well, you should see my mom. She's the one that does, more of this kind of medicine. And so I went to go see her and she had, this bioresonance equipment. And I went in because I was like, look, I got PMS and like I don't sleep great. I get sick all the time and I have really bad like problems falling asleep, staying asleep, and like my stomach hurts with everything I eat. And she's running the equipment and she just goes, oh, do you have OCD? And I was like, oh, well, yeah, but they said I can't. They said it's just, genetic and stuff. So it's okay. And because I believe that, like kind of like you just don't accept it. And she's like, no, we can do stuff for that. And so, okay. So I left with, probably $500 worth of supplements. And I was like, I guess this is what we're doing. And so, a month later, month two later, I was mostly free of what I was doing, obsessive compulsive behavior. And I noticed that because I remember leaving the bathroom and I was like, that's weird. That didn't take any time at all. And it's because I wasn't in there like washing my hands a bunch. And it's just like I kind of forgot. So my brain got quiet, everything got quiet. And it was just like someone took that OCD part out of my brain. And fast forward, how do I do that? Like people need to know because I'd only heard you could do therapy or meds and that was it. And so she said, go to naturopathic medical school. And then fast forward, that's what I do now. And I work with the same equipment that got me better because it was the thing that changed my life. So here we are.
Well, I think, I mean, and when you tell that story, it's so true just because most people never hear that there's any antidote. It's just conditions that we're all dealing with. I mean, like I'm ADD. And so I always tell people, I'm like, we all have, I think, predispositions, but there's antagonists to the entire situation. So, I mean, obviously, lifestyles, diet. What are some of the things that you notice, like that? Because the bioresonance, explain exactly what that is for a newcomer that doesn't understand how that works.
Right. So bioresonance is very similar to muscle testing, except there's less of that human risk for human error bias. So essentially, people send me their DNA, and then the equipment runs itself, and it sends 150,000 different electronic signatures through that, like scanning. So kind of like a radio. So just like when you scan a radio, you might find that you hit one station or channel. We'll just call it liver channel, and it's really staticky, and you can't hear anything. And so, okay, like that information goes to a computer and says, hey, like there is quote unquote static at these different areas of the body, most notably here, here, and here. So we would call this type of testing more quantitative, or qualitative is meaning that like when you, let's say, test your testosterone, that's more quantitative. You're getting a number because you wanted that number. I can't do that with this. So it's giving me qualitative information, meaning what's happening in the body right now that's really showing some sort of priority, and then that's what we would go for. And so that's also why I like it, because that information give me a sense of how to treat in what order. It's not uncommon for people to say, look, I got Lyme and mold and parasites and autoimmune diseases and MCAS and it's just hard when you feel like you're a series of projects, and then to try to figure out, well, wait, how do we
That's
like
true,
how do we
though.
right?
And we totally are, though. I always say that, especially with mental health, that nobody makes, they always treat the brain like it's God, it's just out there. And it's
Right.
not connected to all the rest of the body systems, to our digestive tract. So I'm
Yeah.
always saying, if you have digestion issues, you're going to have mental health issues. If you've got
Mhm.
thyroid conditions, you're going to have this. It's all interchanged, but it's ironic because I think we've all been kind of trained that it's just us and there's
Yeah.
nothing we can do.
Yeah. And that's why I really find the genetic theory for most mental health issues very lazy, because there's never really been an isolated gene for OCD. Yeah, there is some research showing that methylation, like SNPs, like if you have MTHFR, that might increase the risk. But there's no isolated gene that when it's, on or activated or whatever, could indicate a diagnosis. It's not like other conditions in that way. So for me, I think genetic risk factors are not enough to just sort of write something off, especially when writing something off means, hey, stop looking because there's things you could do to fix it.
Right.
And I've seen everything, I mean, from low iron levels, even something really simple.
Really?
Yeah. So you never know like how somebody's going to kind of manifest their symptoms and turn, into something like that. And again, not to say genes don't play a role, but they are not the end of the story. And it's not really a good reason to stop digging.
Yeah, I mean, that's it. Even on my own quest or the different people that I know, it's ironic. Like I said, I was sharing with you earlier that I've been going through testing for various medical conditions that I've been having. And normal doctors that I was seeing, I'm so used to this functional medicine world and the people that are actually getting to the root issues. I'm almost kind of dumbfounded when there's just nothing we can do.
Right.
This is what you deal with. And I'm like, well, what about this? And there's nothing we can do. And
Right.
that's so not true when it comes to mental health. I've just found there's so much that can be done. And especially when it comes to this demographic, like what you're talking about, because there's conditions that are directly attributed. And like you said, how many people are even making the direct correlation of saying you're low on iron?
Right.
I,
Yeah.
the average doctor is just going, well, here's your prescription for your anxiety or for your attention deficit. But like we all want to know, like, what can I do to support my body? And how can I make it run optimally so I'm not having to deal with this or lessen it. So, what are
Right.
some of the conditions, like you said? You said iron. What are some of the other things that you discover on a regular basis with your testing and what you do that
Oh
contribute?
gosh. Yeah, it's been all over. I've seen everything from, hormone dysregulation to low nutrient status, parasite infections, Lyme. I've seen even really low cerebral spinal fluid. Like if
Wow.
somebody has like, yeah, like neck issues, I've seen that do it. Um, Viral infections. And so in a way, literally anything. And that's kind of what I've seen is anything that's causing inflammation in the body could do that. Now not for everybody. And that's why medications are also not a blockbuster because there is not really one thing that I've seen cause OCD. Um, so yeah, it's kind of all over the place, which is daunting, but also a good thing because it means that we have areas to look at and see what could be going on.
I think that's a beautiful thing when someone, like I said, how quickly a normal path of a person dealing with this gets kind of a stop. Like, okay, well, there's not much more, and here's some therapy for you, and here's some medication for you to deal with it. And unanimously, every person over the years that I've spoken to just wants to know, what do I need to do to help myself not have this? And the mentality that you can ever heal mental health or deal with it in a different way has kind of always been out there, like that's not possible. And the truth is, it's absolutely, you're an example of that. That's what I love, is that you're literally an example of, I always tell everyone when I refer people, hello, when I refer people to Dr. Britz, the reason I do is because you can't get much more empathetic doctor than someone who actually dealt with it themselves. And that's really the game changer, is when you're sitting across from someone that actually says, look, I'm not sure, but we're going to figure this out. And
Yeah, yeah, that's the thing
I hear a lot
about.
of the time from individuals that have gone to you is like, oh, she's so wonderful because she just
Oh,
doesn't give up and she keeps trying to figure it out until she does. So that's what's amazing about, and especially OCD, because I would say that we really seem to have, maybe it's that I'm becoming more and more aware, but there seems like there's an epidemic of a lot of OCD.
oh my God, a ton, a ton.
I've never, yeah, I mean, I working in this field, I've seen so much of people. Now, you specialize in anxiety and all mental health, but another thing that you're really known for is helping people taper and find alternatives to the medications that they've been on and getting to their root issues. So you handle everything from SSRIs to anxiety to everything.
Right. Yeah. And that's because for a lot of people, and it's very, very common, someone might go on a medication for the OCD and
Hmm.
find that maybe it kind of helps, but then before they know it, they've been on it for 5, 10, 15 years and their OCD is still kind of there and they've tried different medications and like, blah, blah, blah. But then what I hear is I want to come off it, but I'm afraid the OCD will get worse. But they're already dealing with the OCD. Like the medication's not working, but it's just sort of a different flavor of OCD. And a
Right?
lot of times I'll find when we taper them and deal with what's causing the original OCD, then they don't have it when they're off it.
Really?
So yeah, yeah. And so it's really interesting because sometimes the medications are actually causing what they're supposed to help. Like I had a patient who had horrible anxiety, horrible OCD, panic, restlessness, all that stuff, was taking Klonopin. So a psychiatrist thought, okay, maybe just need a little bit more, which wasn't a horrible idea because, maybe it wasn't effective. So kept upping it. It was actually making things worse. So we ended up deciding like, hey, let's see if we pull it, see if that helps, which is hard because then you're going to deal with some withdrawal. And
Right.
anyways, but long story short, after we pulled him off the med, all that went away. So it was interesting because he did have panic. That's why he got on it. But the med actually made it worse. And it was hard for him and his psychiatrist to figure out what was really happening. And that's not an uncommon thing, which is hard with these medications because it's all clinical. It's not like we're testing and they're going, well, you have OCD, try this drug. It's just based on what they like.
Yeah, I always say the progression always makes me sad when I see people that go from, especially a benzodiazepine, because the next step is pretty much antipsychotics that they start implementing when those are no longer, or they don't want to give them to them anymore, or their dose is too high. And my heart always breaks realizing, even that abrupt change, why they're so bad, and understand, like, you'll see so many people that will be suffering because they have those rapid changes, and yet there's nothing else that's worked for them. And so it's wonderful when I hear I always call it a supported taper, is that if you're doing a supported taper, you work with someone like yourself. I'm surprised at how many people just like, I'm going to taper off the meds. And you're like, oh, have you rectified the problem at all? No, they don't work anymore. So I went off of them, and I'm like, okay, well, now you're going to experience the withdrawals, and you have nothing put in place to help you deal with what you originally put on.
Right.
And so I always say, it's not a anti-medicine movement. It's a responsible medicine movement as to what's responsible to help a person for longevity and health.
Right.
Like, what's responsible. And the sad part is, I would say benzodiazepines are probably one of the most difficult medications to navigate for individuals. And yet that's one you frequently navigate for individuals, correct?
Right. Yeah. A lot of benzos, SSRIs, antipsychotics, and, everything that doesn't quite fit in a standard class. And even drugs that they tell you are not really that addictive, like gabapentin.
Yeah.
Which is true. It is a bridge medication. It's got a wider therapeutic index, and it does help people come off certain benzos. However, there's that group of people that find, oh my gosh, this is awful. And for them, it's its own issue. So that's the difficult part, is a lot of this is sort of unpredictable. I think, and it's not even about fault or blame. People are just trying to feel better. People are just looking for answers and solutions. And I think the disservice is that, most of the time when a patient goes into their psychiatrist or primary care, they're saying, hey, I'm suffering. What they're also saying, though, is like, but why? And can we fix that? And can we work on it? And do we know why? They don't want just the numbing agent. Like, yes, they do want to feel better. They need relief, but they also want to know what's the deal so that we can work on that while I'm getting a little bit of a quote unquote break.
Right.
So that this doesn't come back again. And nobody really wants to sign up for a lifetime drug. That's not most people.
Well, I think that's the beauty of doctors like yourself that have come out and exploded into this environment. There's not very many. That's the other thing. And I'm not talking about all naturopaths in general, but I think some well-meaning naturopaths that don't understand the magnitude of these types of medications. It's, you have to be careful as well to make sure that you're seeing someone who understands what these medications are and how to safely help a person taper off.
Right.
Because in some very well-meaning doctors feel like, well, I rectified this problem, so now you can be off of it, not understanding the magnitude of a taper and what's necessary. So that's why I'm always referring individuals, when I'm referring them to someone like yourself, because you specifically tailor, and that's what your whole practice is about, is tapering and mental health, which is unique as a naturopath. It's not saying, like we said, all the body systems are combined, but let's face it, these medications are very difficult to navigate for individuals if they want to taper off or when they, do both. So that's why you're so highly regarded in this field. As a naturopath, you understand the medications. So that's super, super vital. We are going to be starting to do, mini webinar series so that individuals can start getting a taste of working and some of the fundamentals that you do with every person. I know, like, I've learned so much from this sector of mental health, and you know how much I love it and I enjoy learning from people. It never ceases to amaze me, though. Your caliber of doctor never stop learning as to what other things you're seeing as to contribute to mental health issues or what's going on. And that's what's really unique. Like you said, is everyone just wants to know. So that individual that had low iron, or the individual who had parasites. I remember the first time you had said, I did the bioresonance right when you got it. And he said, "Oh, you have a parasite." And I remember thinking, "I don't have a parasite. That's disgusting." And now in this world, I realize in it, everyone does. And how it's
Right.
affecting us. And the bottom line is in our country, we're not doing regular parasite cleanses, which are in turn causing a host of other problems. So you deal with everything from parasites to mold to heavy metal to everything. Now, when they work with you, you do telemedicine. You also have a practice that's in Las Vegas, correct?
I did, but now I just do telehealth. And it's funny because even my people in, my local area, because it's mental health, so many people are more comfortable at home. And
Oh,
so
yeah.
they were like, "Do you do telehealth? I don't want to come in the clinic today." And I was like, "Yeah, it's fine." So I just found that more people were at, and that's honestly why I did it. Because I remember when my OCD was bad, I was like, I have to get in a car, drive on the freeway, and then go sit and like the whole thing was a lot, like for
Right.
someone, that already was like, I know if I get in the car, it's gonna be a problem. Like, so I wanted to do telemed just because I knew that asking people to do that was just already too much when they're dealing with so much already.
Well, I just recently I was referred you to someone international as well. And I was saying, that I mean, they can order you can order functional medicine testing and such for them regardless where they're located, correct?
Right. Yeah.
Okay, so
Mhm.
that none of that matters. And honestly, that's what we're all looking for. I am anyways. I'm looking for a doctor that actually can do some testing on me and figure out what's going on. And like the bioresonance, like you said, you can send in, isn't it nail or hair that you do?
Yeah, yeah, exactly. And so a lot of times I'll use that in conjunction with other labs, depending on what's going on. Like for example, Lyme testing can be really, really expensive. So it's not uncommon for a comprehensive panel for Lyme and co-infections to range from $900 to $1,800.
Wow.
Um, so because of that, I've had many patients say, "Can we do bioresonance first and kind of see?" And and I tell people, look, it's qualitative, it's not quantitative. I can't quote unquote ask, but if something comes up and it goes along with your symptoms, then I think we might, yeah, if you feel better than looking at your test that way, let's do that. So a lot of times people will do bioresonance, we'll see some Lyme markers, and then they'll go run a very pricey Lyme test, and then boom, there it is. And that's important because sometimes, like, most people can't go into a Lyme clinic and say, "Hey, I did bioresonance, there's Lyme there." Like, you kind of need a test. You need one. And then your like, clinician can go, "Great, now let's start whatever therapy we need to based on what your lab says." So I do still like labs in conjunction for things, like that.
When you do bioresonance, how often is it? Is it usually always, you're just basically backing it up? It's pretty accurate, is it not?
Yeah, I mean, for me, when I first started, I was pretty new and skeptical. So I was doing it with a lot of labs just to kind of confirm and verify. And now I really don't, not until we really need them, especially if it's not going to change the outcome of our treatment. But I think for me, I found it to be so effective and surprisingly useful in so many ways. So I use it now for animals, pets, children,
Wow.
yeah, which has been incredible because I've seen so many people come in and say like, "Hey, my vet doesn't know what to do, and your dog can't say anything."
Oh,
So, they'll send me the fur and then we'll check. I had like it was actually really cool. I had it was a horse. Yeah. Anyways, this ball of horse fur showed up. And it's so funny. I was like, "This is cool." But it was really neat because, she's like, "Look, it's like $500 to get the vet out here every time. And the antibiotics aren't working. Horse had a really bad cough and like acrid nasal dripping, all that kind of stuff." So when I ran him, it turned out he had a really nasty like pulmonary infection, but it was fungal. So once I figured that out, then I could test different nutrients and supplements and things like that against his DNA to work better. And I was like, "Look, I need you to get a portable nebulizer, like, and we have the concoction there." And I was like, "Hold it up against his nose so he can breathe it." We did some herbals. We just changed his nutrition. And she called me crying. She's like, "Oh my God, he's not sneezing, he's not coughing, he's fine, his lungs sound good."
oh my
And it
gosh.
was very simple. So yeah, I love that. And
Dr. Britz is turning into a vet too. All of
one
a
day
sudden
I
get
totally
people
will. But
studying dog hair and cat hair all the time.
You should see my mail. It's so funny. Like I have like it's
I'm
like you can
sure
see
your
this mail
mailman
gets
looks at you like, what's this girl do, man? I
I know it's
uh,
hilarious because like you'll see like the mail's been pressed because like stuff's been on it, and so you can see the outline of what's in there, like outline
no,
of like so funny. I'm like this,
now I want to send off Ginger to you because I'm like, gosh, she keeps breathing weird. And
you
you're right.
should.
It's like they can't ever figure anything out. You know, they're always looking like, I want to know. Yeah. So, Julia, Dr. Britz, you are probably one of the top people that I recommend for individuals who are seeking anxiety, OCD relief. And I say relief because this sector of people can't get relief.
Yeah.
I mean, it really is true. Even with the medications, oftentimes it's a window of time that they have the relief, and then the body acclimates to the meds. They're addicted to the benzodiazepines. They don't know what else to do, and you really are. You makes me choked up. You really are one of those people that are changing people's lives because they're suffering and they don't know where to go. And so myself, I feel so confident when I've done numerous interviews with you and would never stop because the effectiveness of your care is so outstanding and you're so thorough. But the most beautiful part is how empathetic and kind you are for these individuals that are profoundly suffering from OCD and anxiety and medication tapering and depressive disorders. But your choice to deal with this demographic, you could have chose. I always say, why didn't I choose weight loss? Something because let's face it, this demographic of choosing to serve is hard because people are at their wits' end and they don't know where to go and they don't know what to do. And I had a person call the other day and they had a young boy. He was 14 years old and they had gone through everything. And the mother was upset and she was crying. And without a shadow of a doubt, I immediately said, I know who can see you and can help you. She is the best at OCD and anxiety. And if you don't believe me, go look at her TED Talk. But you're compassionate, you're thorough, you help people get to the root issues. And I don't know that there's anything more that people are asking for other than that right now. They really are. So if you want to work with Dr. Britz, there's links below that you can book appointments. She does telemedicine. She sees people around the world, certainly all over the United States. I know in Canada. But her specialty is helping people get to their root issues. And if your desire is to taper off medications, she's very knowledgeable about that. Like I always tell people, don't ever abruptly stop medication. If that's the one thing that we will say over and over again, there are huge ramifications to abruptly stopping psychiatric medicine. Please work with a professional. Don't just choose to do it on your own. And if you want to work with Dr. Britz, she is a specialist in this field, and in particular, of course, all mental health. But if you suffer OCD and anxiety, this is the queen that can really help you maybe get to the root issues of what you're dealing with. And I appreciate you. I appreciate you because we need more doctors like you. And so the more that I find someone like you, the minute I met you, I knew you were special. And I don't think I've ever had a person that I've not referred that still doesn't talk about this, about what a special doctor you are, because you do find, now it doesn't always happen overnight.
Right.
It's a vetting process. I mean, truthfully, we hope that you find out it's iron right away.
Right.
We find out whatever, but all we can ask for is someone like you. That's all people are wanting, is someone who's saying, I don't know what's wrong, but I'm going to help you try to figure this out. And you've got the best when you talk to Dr. Britz. So thank you.
Thank you so much, Debbie.
No, you are. You're just, I just feel such a sense of peace when there's people who are profoundly suffering. I always know And we were talking about this with other individuals that are in the industry, and this other individual said the same thing. You said absolutely. When it comes to referring someone, I have no problems. I feel so confident sending someone to Dr. Britz. And,
Mm.
that says a lot. I mean, you've been doing this, you started on this passion, and you're on social media, you're constantly always trying to do things of bites to help people be inspired and realize this can and is being done all the time. Because I think that's the big thing is most people don't realize that people like you exist that can help them. And most of the time, they're just kind of suffering in silence and realize, wait, there is another whole sector of doctors that do what?
Yeah.
That's you. So below, we're going to link all of Dr. Britz's information that you would be able to work with Dr. Britz. We are working on producing mini webinar series to help individuals get further introduced to these professionals so that they can get a greater perspective as kind of some of the foundational pieces at how they treat and what they do to help you get on your path. Obviously, doing comprehensive testing with bioresonance and stuff with her is the best that you can do. But we're recognizing with this platform, we're trying to create a synergy of resources for individuals suffering from these conditions that you can introduce, get to know, and work with these people, because I promise you, every one of them have brought, God, see, I get so emotional. I don't know why, but with you, different doctors make me feel that way. And I guess it's because I know the people you've worked with.
Mm-hmm.
And I know the people that you've changed in their lives, and what a confident feeling I have doing this and exposing the work of people like you. And that's what we need. That's what the world needs, is more Dr. Britz's. And the more that we have, the more that people are going to get that 14-year-old that hopefully finds what's going on, because, there's literally thousands and thousands of people that are suffering and just don't know what to do. Right. And so when we hear voices like yours, it feels like there's a solution, and you're a solution for people that suffer. And you're an amazing example of a doctor who suffered profoundly. So I love you.
I love you too.
Thank you for doing this, Dr. Britz. I admire your work, and there'll be links below. And this won't be the only time, because Dr. Britz is very prominent in this community of helping individuals taper. So this is one of many things that I'm sure that we will feature you, just because, everything from OCD to mold exposure to all the different things that people are dealing with, SSRIs, trying to come off of them, benzodiazepines. If you're tapering off benzodiazepines, Dr. Britz is phenomenal. She's got protocols to be able to help you lessen that horrible taper that happens with individuals that can be really, really hard. It really lessens it whenever they work with someone like you. And that's the one thing I also like to point out with people, is that if you're not doing a supported taper, and what I mean by that is nutrition, supplements, you're really leaving yourself up to not being a taper, but a drug transfer. And that's right. Typically what happens is when we start having the withdrawal symptoms or the return of symptoms, you're working with individuals that their only antidote is a different medication. So if you're wanting to get out of that paradigm, these are the type of doctors that will help you do that. A normal doctor, right, they're going to help you taper, but when it starts going really bad, their only other thing is to give you something different. And so these are the doctors that the tire hits the road and can change your life. So thank you, Dr. Britz, for taking the time. I love you. I think you're amazing. We are going to proceed forward and keep linking all these amazing doctors together. And Dr. Britz is one of the top ones I recommend. So thank you.
Thanks, Debbie.
All right. I'm Debbie Nelson. I'm here to change the world, and I'm not alone. And you're amazing, Julia.
Thanks, Debbie. Appreciate you.
Thank you for taking the time.
Bye.
Bye.